Hey, in this video, I'm going to talk about dihydrotestosterone or DHT. I'm going to talk about testosterone and the relationship between the two with 5-alpha-reductase enzymes. I'm also going to talk about how you can affect this conversion with natural supplementation to help prevent things like hair loss and prostate growth. So if that's interesting to you, please stick with me. I'll explain how you can implement some of these things to hopefully get the results you're looking for. So first, I want to start by explaining what these compounds really are. Testosterone, surely you've heard of. It's an anabolic androgenic sex hormone in men and women, just in a much smaller amount in women. But this is circulating throughout a healthy male body all the time. And DHT, dihydrotestosterone, is a derivative of testosterone that you get from the 5-alpha-reductase enzyme acting on testosterone to give you the result being DHT. I'm not going to go super deep into the biological process or the chemistry of that, but I just want you to know that DHT does come from testosterone and it has to go through a conversion with this 5-AR, 5-alpha-reductase, to make that happen. That's critical. So what is DHT? DHT is similar to testosterone in the sense that it is an androgen. It is a male sex hormone or a virilizing hormone, but it is much stronger than testosterone in a certain sense. So it has a much stronger binding affinity, meaning it acts on androgen receptors much more strongly than testosterone does. It binds about twice as readily as testosterone, and it'll stick around about 5 times as long as testosterone. It's also considered a pure androgen because it cannot be converted to estrogen, unlike testosterone. I did a previous video on the conversion of testosterone into estrogen through the process of aromatase. And if you want to check that out, it was before this, a video on indole 3-carbinol, I3C, and DIM can help you learn how to slow down the conversion of testosterone to estrogen in your body if that's something you're dealing with. But anyway, so this is considered a pure androgen. It can't be converted. And additionally, DHT doesn't circulate quite as much in the same way as testosterone does. So DHT really is made at the sites where it's going to act, meaning testosterone is circulating through your blood all throughout your body. And then when it gets to certain areas like your scalp or your prostate, then this reaction between 5-alpha-reductase takes place, and now the DHT is present in those local sites where it can then act on this androgen receptor. If you don't know what an androgen receptor is, think of it as just the socket where this androgen, this DHT, gets plugged in. So most things in your body, like testosterone, if it's circulating, it doesn't do anything until it's plugged into one of these receptors and it makes that connection, and now it can start to do its job. So DHT is made, think of it, it's made right next to the plug. How about that? Or made right next to the socket. So it's made in these areas with the 5-alpha-reductase, and then it plugs in and starts doing its job. Now, when we are in utero for a fetus, DHT is responsible for the male characteristics, visible male characteristics. So like the development of the penis and the scrotum. And in children who have a DHT deficiency or are unable to make this conversion, those children are born appearing to be female, but as they get closer to puberty and things like higher levels of testosterone and luteinizing hormone kick in with the progression of their pituitary gland, then they will start to get virilization. So you will start seeing male characteristics, which must be pretty alarming for everyone involved. But in a healthy young male, DHT at puberty is responsible for the same kind of things: growth of penis and testicles, growth of body hair, facial hair, growth of bones, musculoskeletal system, height, all of that stuff. Virilizing, meaning making a man seem more manly. Because DHT is, again, an androgen. It's that male sex hormone. So that's what it's doing in adolescence, in a fetus. That's why it's there. It serves its purpose. But as we get older, that purpose becomes a little different. So as we get older, DHT mostly is causing your hair to fall out, and causing your prostate to grow through benign prostate hyperplasia, which is prostate growth exclusive of something like cancer. Benign meaning not metastatic. So DHT plays a critical role in the growth of the prostate and hair loss. Keep that in mind. It also does seem to have an effect on libido, and that's been studied with men who are eugonadal, which means men that have testosterone levels in a healthy range, but are having troubles with libido or erectile dysfunction. So men that had normal levels of testosterone were tested for DHT, and in men who had abnormally low DHT levels, some of them did struggle with libido, sex drive, achieving and maintaining an erection. So it does play some role in that, but also going too high on that level is we're going to get things like the hair loss, the prostate growth. So there's a healthy range. And again, that's something to keep important too, that DHT does play a role. So like I talked about in my previous video with, stopping or slowing down the conversion from testosterone to estrogen, in the same way we didn't want to totally crush all of our estrogen levels because it is important, just it has to be kept in check. DHT is the same way. It's important, it's playing a role, but it has to be kept in check. So we don't want to crush it to zero, but we don't want it to be running rampant. Now, some men will, much like anything else, genetically will have different affinity to these drugs. And I shouldn't say drug, these chemicals, they can be used synthetically as well. But let's say these chemicals. So your body will do different things with those chemicals. And some men are more prone to things like male pattern baldness, which is driven by DHT, or prostate growth. So they might have a bigger affinity. They might have more androgen receptors in those areas for that DHT to work on. So with that in mind, a lot of people want to do something about that DHT to keep it in check. And all of these things are really, again, this is pretty well studied and pretty well known. And from the drug standpoint, there are drugs out there that are DHT derivative drugs. These are usually used in things like, now they're more common in things like bodybuilding. They're used as performance enhancing drugs because, again, DHT is a strong androgen, which means it can create tissue growth, meaning muscle growth, or the strength of connective tissue or your bones. And so people will use it for that kind of thing. But we do know that the side effects of things like something like drostanolone, that's a DHT derivative drug, commonly called Masteron, a steroid used in bodybuilding to make men kind of dry out, seem more striated, it's considered a hardening agent. That's a DHT derivative, and the most prominent side effects with that are hair loss and prostate growth. So we're not really shooting in the dark anymore. We know what DHT is doing. So we have those kind of drugs out there that are doing those sort of things. Now, men are looking for hair loss is something that a lot of people struggle with. A majority of the population after a certain age is going to deal with male pattern baldness, hair loss of some sort, exclusive of something like telogen effluvium, which is just like transient hair loss. This is the deep, the receding hairline, the circle on top of your head, that pattern of baldness, not diffuse thinning, but what you think of as someone going bald. That's driven by DHT, and people are looking for ways to stop that. Some of the most common things that we'll see for people to use those pharmaceutically, that if you go to a doctor and say, hey, I'm losing my hair, they're going to probably tell you to take something like Finasteride or Dutasteride. Now, both of those drugs are 5-alpha-reductase inhibitors. So remember, I told you that 5-alpha-reductase is an enzyme that converts testosterone to dihydrotestosterone. Sometimes these drugs are mislabeled something like a DHT blocker. That's not true. What it's actually doing is trying to stop the conversion. It's not trying to get rid of the DHT once it's there, but we're trying to slow down the conversion. Now, these drugs are effective. They also come with very serious side effects because they do crush those DHT levels. They will stop that conversion, and they are taken internally. So this runs systemic. Now, Finasteride, as you maybe have heard the names Proscar or Propecia, those are trade names used with them. It's mainly prescribed for benign prostate hypertrophy, so that growing prostate. Some men, again, will use it off-label for hair loss. Some people use it, it's prescribed for hair loss, just at a lower dose. However, like I said, DHT is important in things like sex drive and achieving and maintaining an erection. So the side effects of totally crushing your DHT with finasteride are things like erectile dysfunction, loss of libido. There is pretty serious side effects of depression that have been reported of people coming off finasteride. You can look up something called finasteride syndrome, and it is pretty serious. People coming off of drug that, maybe there are some natural alternatives out there. Additionally, I'll just read some off for you. Some serious side effects are gynecomastia, rash, itching, hives, swelling of the lips and face, difficulty breathing or swallowing, and an increased risk of developing high-grade prostate cancer. So people taking finasteride in an effort to slow down the growth of their prostate do take the risk of developing prostate cancer due to this drug. None of this is anecdotal. You can look this up. All of this is admitted by the manufacturer. So I'm not making any of this up. These are the quoted side effects. Dutasteride, similar drug to treat prostate hypertrophy, growing prostate, not as much for hair loss, but again, the problems we see: reduced libido, problems with ejaculation, gynecomastia and lactation, swelling of the face, tongues, and throat, difficulty breathing, both those probably all coming from anaphylaxis, someone being actually allergic to the drug. And then finally, again, increased risk of high-grade prostate cancer. So in my mind, if you're trying to stop the growth of your prostate, but the thing that does it potentially gives you prostate cancer, I don't know if that is a fair trade. Now, I'm not a doctor. I'm not telling you that if you're taking these drugs that you should stop. I'm just saying this is what's out there. This is accepted knowledge about these drugs. And, if you're concerned about them, you should talk to your prescribing physician. If you're not to that point yet where you've gone the pharmaceutical route, or you're just interested in what naturally is out there, there are foods and supplements that pretty effectively can regulate this 5-alpha-reductase conversion. So they would be considered natural 5-alpha-reductase inhibitors. There's been quite a bit of study done on this. Some of them have been kind of happenstance. It's just things they found looking for something else. But some of it came from the fact that we were able to look at a lot of Asian countries and see that men in Asian countries do not have the same prevalence of hair loss as in Western countries. And so with hair loss being such a big thing that people are concerned about, and such a valuable market for people producing pharmaceuticals or producing supplements to stop it, people wanted to know what were they doing that is producing this different result. So they started studying the food of Asian men, and what you see is that Asian men naturally eat a lot of foods that are high in these 5-alpha-reductase inhibitors. Now, top of the list for a natural 5-alpha-reductase inhibitor is something called a reishi mushroom. You might have seen it labeled as Ganoderma lucidum, and that's the reason I've got on my mycologist hiking club shirt today, in honor of the fact that a lot of these 5-alpha-reductase inhibitors are mushrooms. Others aren't, but the very top of the list that slowed down the conversion somewhere between 70 and 80% was reishi mushrooms. Now, if you look for 5-alpha-reductase inhibitor supplements, I had a buddy that sent me one, and I saw in there Agaricus bisporus. Now, Agaricus bisporus is a white button mushroom. You ever got mushrooms on your salad at a restaurant? That's what they were little white button mushrooms. And although they do have an effect on 5-alpha-reductase, it is very, very minimal. Something around the area of 5% reduction versus 70 to 80 with reishi. The reason you'll see that in supplements is they're cheap. Agaricus bisporus is very inexpensive. You can grow a ton of it quickly. And so they're able to put something in there and say that it does have 5-alpha-reductase inhibition effects, just not very much. If you want to go the route of the mushrooms to do this, I recommend reishi, or second in line is oyster mushrooms. Those are pretty high in this potential to reduce the 5-alpha-reductase. Now, I always am going to advocate for putting things in your diet rather than a lot of supplementation if it is feasible. I really like oyster mushrooms. You can cook that in with a lot of different stuff, stir fry, whatever. Same goes for the Agaricus bisporus, the button mushrooms. Add that stuff to your diet by all means. There's a lot of other good benefits to it. And, at least a little bit, you're getting some of this DHT regulation. And again, regulation, it's not going to crush it. It's just going to bring it down more likely to a healthy level for you. Now, reishi is a bit of an exception to that. Reishi is not something you're really going to chop up and put in your food. They're usually pretty dense. They're a little more difficult to grow. You won't probably, depending on where you live, if you're in northern climates, you may be out and able to find them, to forage for them, but it's less likely they're going to be on birch trees. Where I am, I'm down by the beach. I'm not going to be able to find them around here. And they're not going to be very palatable. So something like a supplement, a tincture, would be a good idea. I just picked this up knowing I was going to be doing this. This is a reishi tincture, which is a common way you'll find it. You also find it in powders. So I picked this up from Locals Farmers Market. If it's something you're interested in doing, veilofparadisemushrooms.com. I don't know if you can see. Yeah, there you go. So an important thing, if you are looking for supplementation, I'm not sponsored by this. I paid for this. These guys weren't telling me to say anything about it. But another thing that I would tell you is important is if you can see that it says it's from the fruiting body. If you're going to do anything mushrooms, I'd encourage you to go with fruiting bodies, because that's where you're going to get most of the things like beta glucans, which are the chemicals that you're really looking for to have these effects. Now, you could take something like this, you could put it in your tea, you could put it in a drink. Again, eat the oyster mushrooms. They're great and they'll take on flavor well. But one thing about consuming reishi mushroom, they have tons and tons of other health benefits. They're considered in certain places, I think, it's the immortality mushroom, because they're supposed to make you live forever. Obviously that isn't true, but they are great for your immune system. They do a lot of other things, blood pressure regulation, all kinds of stuff that you can look up and figure out about reishi. But I'm just going to talk about the DHT in this video. So you could eat that, you could drink it, get all those benefits, and some of that benefit will be a DHT regulation. However, when you do consume them, it has to go through your liver, and your liver will break down these beta glucans. It'll break down these chemicals pretty quickly, and they won't necessarily have a persistent effect that you would probably want for something like hair loss. Now, if it's something like prostate growth, then you're going to need to take it internally by mouth. But if you want to do the hair loss thing, there's pretty good evidence that you could take, and this is a great delivery system, really. If you can find something like this with a dropper, where you could suck some up and then drop that directly on your scalp where you're experiencing hair loss, because that conversion from the testosterone to the DHT is happening in areas like around sebaceous glands, near your hair follicles. That DHT, once it's produced, will act on hair follicles to shrink, and eventually those hair follicles die. Once that happens, they're gone. Now, if you're just in the stage of shrinking and you can stop that DHT presence, then those hair follicles can kind of grow back. They can become more, they can get more size to them, which shows more thickness in your hair. So locally, there's good sign that you could do something topically and have a good result. So I would take that, if I was going to do something for hair loss, and drip that on my scalp. There's not going to be, you're not looking at any kind of side effect from a reishi mushroom unless you are allergic to it. Now, if you do put something on you and you have some sort of reaction, stop doing it. You might be allergic to it. You could be allergic to the solvent in it. But just like with finasteride, dutasteride, the risk of prostate cancer is not worth hair loss, right? So if you're hurting yourself with something like a natural supplement, don't take it. Find something else. Now you can go online, you can go on Amazon and you can find lots of reishi, all kinds of stuff, supplements, tinctures. I would just tell you, be careful where it comes from. Certain countries don't have good quality control, and mushrooms are what are called hyperaccumulators, which means they can pull a lot of things like heavy metals out of soil. They end up in that mushroom. You end up consuming it. If you didn't know, heavy metals are really bad for you. So I personally prefer someone local that is growing organically and you know what they're growing on, which again, these guys are local to me, valeofparadisemushrooms.com. They are local to me, so I feel good about what they're doing. Hope to make a visit to their grow site and really see it up close. Now, if that's not something you want to do, you're not going to do the mushroom thing. Saw palmetto. Everybody knows, well, I shouldn't say everybody. A lot of people know that saw palmetto is recommended for people that are dealing with an enlarged prostate. Well, now you know why. Because it stops this, doesn't stop, slows down this conversion of 5-alpha-reductase or testosterone by 5-alpha-reductase into dihydrotestosterone. So you'll see that in a lot of prostate health supplements. That's why it's there. EGCG. That is an antioxidant that is present in green tea. So all of these things, again, I mean, I don't know why you'd be eating a lot of saw palmetto, so maybe not all of them, but having a cup of green tea a day, if you are not overly sensitive to caffeine, green tea has a lot of good benefits. Mushrooms have a lot of good benefits. So add these things in your diet and then reap the benefits on all the DHT. Sides. You're going to get other good stuff from it. Whereas a lot of people will do things like they're not going to take care of their diet, but they'll take a drug like finasteride. That's a lose-lose in my opinion. Go for the win-win. Get something healthy in your diet that's also doing something that you need. Now, don't go overboard. There are things like pumpkin seed oil that apparently has some DHT regulation effects, but it can crush your levels really low. And when people start combining a lot of these things together, the effect can be too severe, which should show you that these things are effective. But if you get to a point where you've started doing a lot of the supplementation, maybe your hair is growing back, it's getting fuller again, you're excited about it, so you push it further. Slow and steady is always the way to go. But if you're pushing this and you think, I got to get this right away, I'm really nervous because I'm seeing my hair fall out, I'm going to do everything at once. Well, there's also a lot of evidence that men that do things like that do start having issues like erectile dysfunction, reduced libido. So everything in moderation. Don't go crazy with all these things at once. Start gradually, see what works for you, see if you can slow down the progression. Now, if you have male pattern baldness and you have places where there's no hair at all anymore, there's not even the little baby hairs, hate to tell you, the only solution there is going to be a hair transplant because those follicles are dead. But if you have places where you got little baby hairs, it's real thin, something like a topical reishi, that's the time. And doing something internal to start to slow down this DHT, that's the time to start doing that because that hair can be saved. So that's good news. But yeah, I mean, if there's any other things that I can help you with hormone regulation, like I said, I'm going to start doing more of this stuff. I know this is information that a lot of people want, and it's stuff that I've dealt with for a long time, and I've studied for a long time. It really interests me. So like, comment, subscribe if you want to see more stuff like this. I'm going to keep doing it either way, but if you want to be notified when it comes out, that's the best way to do it. Comment on things that maybe you want to learn more about. Maybe there's supplementation that you've been curious about, you've heard about, and you want to know, is it really as good as it's supposed to be? I don't mean brands or companies. I'm talking about things like a reishi mushroom, EGCG, whatever, the benefits of it. And if you want individual coaching, you can reach out to me at brooksbrowncoaching.com, and you and I can get set up one-on-one for both health training and success coaching, where we can talk about this more personalized to your goals. So something to keep in mind as well. If you've made it this long, I appreciate you watching, and I look forward to talking to you all again soon. Bye.